Good morning, everyone. My name is Hartford Healthcare's Tina Verona. Thank you so much for joining us this morning for our media briefing. We have a great panel of guests with us today. We have our usual Dr. Ajay Kumar, our Chief Clinical Officer. We also have Dr. Ulysses Wu, our Chief Epidemiologist here at Hartford Healthcare. And we have a special guest with us today, Sergeant Jonathan Bransford of the Connecticut Army National Guard. Yesterday, the National Guard began their support effort at Hartford Healthcare testing trailers throughout the state. So we're going to hear from him. He's at Midstate Medical Center today. We'll hear from him in just a bit. But as always, we're going to kick things off with Dr. Kumar for the latest data across Hartford Healthcare.
Thank you, Tina. Good morning, everybody. I hope everybody's doing well. So we have some positive trend to report today with declining number in the state of Connecticut in hospitalization and also in Hartford Healthcare as well. Today, we have 518 patients admitted to Hartford Healthcare in different settings. That includes almost 35 patients actually in behavioral health setting. And I want to highlight those individuals. They're here for behavioral health issues, not for COVID-related issues. Our Bacchus Hospital has 47 patients today. Charlotte Hungerford has 27 patients. Hartford Hospital, that includes Institute of Living number, is 233 patients. Midstate Medical Center has 43 patients. Natchag Hospital has 5 patients. St. Vincent Medical Center has 70 patients. Hospital Center, Connecticut still has very high number, 79 patients. And Windham Hospital has 14 patients. All in all, we are seeing a declining trend in hospitalization. And that might be a sign to come about how we might have to deal with next several weeks to come. Dr. Wu will talk a little bit about the epidemiology in the state and the trend we are seeing as well. So I'll pass it back to Tina for further questions and comments.
Thank you, Dr. Kumar, for that update. And I'm going to turn it over to Dr. Wu. I know we've been talking about the peak and the numbers and the decline in the state and what's happening and what you're seeing from an epidemiology standpoint. So Dr. Wu, please.
Yeah, it's all good news, as Dr. Kumar talked about. I feel like I'm talking about the weather. We got a cold front coming in that is not such good news. No, seriously, in terms of the peak, it's looking good. It looks like we've passed our peaks with regards to almost all of the measures that we are following. And the good news that I want to look at, pay a particular attention to, is really the data from yesterday. We had a drop of 72 hospitalizations across the state. Discharges are exceeding admissions for a couple days in a row at this point. So that is always a good sign. Here at Hartford Healthcare, as Dr. Kumar alluded to, we had a very nice drop in our COVID positive patients within the hospitalization. So I think that we're on the downslope of our roller coaster at this point. The deaths still remain a little bit high throughout the state, but we have always expected that to lag. So I expect that is going to continue to drop. As I've been saying in the past, I do expect a long protracted tail that is kind of sawtooth, will go up and down, but I am very appreciative of the actual rate of decrease in numbers at this point.
All good news. Thank you, Dr. Wu. I want to turn things over now to Sergeant Jonathan Bransford. He is at Midstate Medical Center today, where he is joining us. Thank you for being with us today. We really appreciate it. And tell us, you started yesterday. Tell us how day one went yesterday with testing out there.
So day one, yesterday, we got it on ground around 11 o'clock in the morning. And we had only 105 people that got tested. There was 63 appointments, and then 42 of them were walk-ins. Initially, I believe the site was supposed to be appointment only. And then once it did get fairly slow throughout the day, we allowed walk-ins, and we actually had a pretty good turnaround of walk-ins. I can actually start with certain sectors of the site in itself. Initially, it's just 2 lanes of traffic. It's fairly simple. And again, just getting on ground, I only have 5 soldiers here myself. So it's been pretty simple. Everyone's been very helpful, especially working with Hartford Healthcare, from supporting us and us supporting you. And it's been a great process so far on the first day.
Yeah, we appreciate it. Sergeant, can you just sort of give us the lay of the land? You said you have 5 soldiers out there, and I know they're at different areas of the testing trailer, but just give us a little insight, and if you can, show us a little bit about what you and the rest of the soldiers are doing. And thank you, by the way, for your incredible effort in being out there and supporting us at our testing trailers.
Thank you. We appreciate that. Yeah, so what I can do is I can go ahead and flip my camera right now. I'm at basically our point A section at the moment. Let me flip my camera here. Okay. So right now, this is our point A. I have a soldier who's actually right now, this is perfect timing. There's someone coming up for an appointment, or it's just sometimes just typically driving by. Luckily for most of us, I included myself, we're all military police officers, so doing traffic control is definitely part of our thing. So public safety gave us a vehicle that we can utilize to keep our soldiers warm. You know, the weather's a little tricky today. So point A on this side is strictly for appointments. And then we have a second lane of traffic over on this side here. This is for our walk-ins. So I'm gonna just kind of walk down the site right now. You come down this way, it's a little bit of a walk, so just bear with me. I have a soldier down here on this corner who asks, you know, hi, sir, ma'am, do you have your ID? Any type of paperwork that you have with you? Do you have an appointment? Are you a walk-in, etc.? And then we just direct them where to go down to the trailer where the actual test is being conducted.
And then how are they assisting in those once you get down to the trailer?
So when you get down to the trailer, I have, I believe there should be 2 soldiers in there right now. We have a pamphlet of information which is given after the test, but the biohazard bags that actually have the test in them with the test tube and the stick for swabbing is actually placed inside the bag. We break the stick in half for them, is something we decided to do. We put our gloves on, we break the stick in half to avoid them dropping it, because sometimes the swabs get dropped inside their car and then of course they have to start all over again. So our soldiers just give the instructions, 10 to 15 seconds in each nostril, cotton side down back in the tube, make sure it's nice and tight for me, place it back in the bag. We take the bag back and it gets placed inside the trailer. And then they're told with the pamphlet of information that they'll receive the results in 48 to 72 hours.
And how long are you out there for today? How long are you and the rest of the soldiers out there for?
So we get here a little early, around 7:30, just to help set up in case we have to move a couple cones around. Some of these bigger drum barrels here, we just place them for traffic overnight. But typically the site opens up at 8 o'clock in the morning and we close at 4 o'clock in the afternoon.
And what is the volume like so far today? Has the weather impacted that in any way?
So far today, I don't think the weather's actually impacted it too much. Throughout this midday process, I'm actually personally seeing more cars than we did before. See, we have vehicles down here now that are all starting to line up to get to the trailer there. Right now, I believe we have 96 appointments scheduled. I checked in at 10:15 and 23 people have been tested so far, 7 of them being walk-ins. The rest are all appointment-based. And I know yesterday we actually had a little bit of a rough number of just over 30 people who made appointments and actually didn't show up.
And we do want to stress it is by appointment only.
No, we started allowing walk-ins yesterday, and I believe we're doing the same as well today to keep the volume up.
Great, wonderful. And your support, again, as I mentioned, is greatly appreciated. And these testing trailers throughout the state and having the National Guard support, as you really have supported us throughout the pandemic. Of course, when we had to set up as a temporary field hospital over at the convention center, you were all critical in that role too, and continue to support us. So we're very much appreciative.
Thank you. We appreciate it, and we're glad to be here to serve and help take care of our state.
Sergeant, where are we right now? What are we looking at right now?
We are right outside we're right outside the trailer. I'm gonna go ahead and flip my camera again. We're right outside the trailer here. Entry door is here. I'm just gonna put my mask on very quickly and I'll give you a walk-in inside the trailer.
That'd be great.
Okay, so inside of the trailer, we have our Hartford healthcare workers working over here in this area, and then our soldiers working in this corner. The first window is set up for registration, appointments, walk-ins. We get everybody into the system. And then the second window here where my soldiers are working is actually where we administer the swabs, swapping out gloves, and then our test kits when they've been completed go in bins and they get dispatched throughout the system so that everyone can get their results.
Great. Well, thank you for that show and tell. We are at this point going to open it up to questions. And I know there's a testing question first up from Dave Altamari from the CT Mirror. What are the testing sites looking like? Are you filling all of the appointments at the trailers that you recently set up? Dr. Kumar, do you want to take that one?
Yes, Dave, we'll be sharing numbers with you later on as we progress, but we are seeing a high demand at the moment. There is a fair amount of demand, and and folks are showing up. I don't actually know exact full rate right now, but we'll provide you numbers as we go forward.
Dr. Wu, do you anticipate those numbers to continue going up where we are seeing the, where we are with Omicron right now? Do you anticipate those to keep going up, or what do you foresee happening with the testing?
It depends what marker we're talking about. I don't anticipate almost any of those markers, at least with the acute care, to go up at this point. I think our positivity rate is still going to remain high. And what do I mean high? I mean relatively high. Remember, we're in the high teens, and we really haven't been in that area really ever in the last year and a half. So I think we're still going to remain high relatively, but I think it's all going to drift down eventually.
All right. I see one other question here in the chat from Mike Savino at Channel 3. What do you expect for testing demand going forward? Do you expect it to drop at some point, which we just talked? Mike, you and I are on the same page today.
I can comment on the second question. How does it impact?
How does it impact? Yep.
Mike, our goal in Hartford Healthcare is to be able to provide access to the communities. And I think we want to make sure that individuals who are unable to get the testing done for a variety of reasons have some access. We'll modulate our response based on the demand, but right now we will continue to provide access for several days and weeks to come, and we'll see where we go with that. There is still a significant concerns we have of folks not being able to access the testing on timely fashion, and that's what we're trying to resolve at the moment.
Okay, another question coming into the chat. Data out of Israel shows a fourth COVID shot isn't as effective. What do we think that means for boosters going forward? Dr. Wu?
I still think we need to examine the science behind this, and it really depends on the timing of the boosters. A fourth COVID shot isn't as effective. It doesn't mean that you lost a complete immunity at that point. They're just looking at really the top of the curve at this point. And so it is a possibility that our immunity may last longer than we had thought before with 2 shots and a booster at this point. What we really need to do is look at that science, and we're going to continue to follow the data that after your 3rd shot, how long that immunity lasts. And then once we get into possibly an endemic phase next year, there is a possibility that boosters are going to be needed going forward as well. But right now, the booster is still your best defense against Omicron at this point. And there is no need for an Omicron specific vaccine, though I know that is also being developed as well.
Another question from Mike. Could those boosters be strain specific like the flu shot?
Well, I don't want to look at the strain-specific shots as a booster. I want to look at them as sort of novel vaccines towards that variant. So if there is a variant that is requiring a completely new vaccine, then I wouldn't look at it as a booster. I would just look at it as a new shot. But I understand the ask from Mike about is it similar to the flu shot? I think it's going to be very different from the flu shot, because the flu shot is really prepared ahead of time for influenza season, whereas I think with the COVID vaccines, it's going to be after the fact. So a little bit different.
Question from Dave Altamari at the CT Mirror. How many people are in the ICU today, and is that number decreasing as total hospitalizations are?
Mike, you didn't miss that. I did share the number. We have 64 patients in critical care today. 42 are on ventilation who has COVID right now. The numbers are kind of on the plateau or declining side at the moment. We expect those numbers to go down. Largely, I just want to remind everybody that our patients who are in ICU or requiring ventilations are unvaccinated still, and those individuals generally have a prolonged stay in the hospital as well.
Question from Tracy O'Shaughnessy, the Waterbury Republican American. How frequently do you think we will need boosters, and is there a danger that we lose efficacy with every booster? Dr. Wu?
I think I was kind of answered with Mike's answer, but I'll say it again. The need for boosters will be dependent on the science, and the science will tell us when we need boosters, if we do need additional boosters. I don't think that we will have vaccine-specific boosters. We'll have vaccine-specific shots going forward. I'm trying to think, what else did I say? Oh, I guess boosters may be needed if we enter into an endemic phase, like this time next year or October of next year.
All right, I do not see any other questions in the chat today. So if we want to start with final thoughts, Dr. Wu, let's begin with you.
First of all, I'd like to thank the sergeant for his help and his assistance and his soldiers as well. I really appreciate this. It's nice to see, you know, the community brought together to really help fight against you know, a disease that is for the most part somewhat preventable at this point. And so that leads into my next point. Everybody, please get your boosters. That's the best way to fight this at this point. Do all the other things that we certainly talked about. Even if the numbers are getting better, we don't want to relax and take our foot off the pedal at this point.
And Sergeant Bransford, I see you made it back to your vehicle.
Yes.
Final thoughts. And by the way, thank you for that, Stuart. It was really helpful. Final thoughts that you'd like to share.
I just want to say thank you for having me. Thank you for giving me the opportunity to post what my soldiers are doing and all the hard work that they're putting in to assist. And we're happy to be here and continue to serve our state, take care of our state. And this is what we do. So we're just really happy to be here and be a partnership with everyone that's been a part of this so far.
Well, we are certainly happy to have you and your soldiers, and thank you for your continued support throughout this pandemic. It is greatly appreciated. We're very, very grateful.
Thank you.
And Dr. Kumar, final thoughts for the group.
I'll echo your and Ulysses' gratitude for the sergeant and his soldiers as well. And after that, I will make a comment. As Ulysses mentioned, it's largely preventable. It's really something very important for us to remember. We are still seeing a high mortality in individuals who are not vaccinated. We are managing pandemic at this time, but we've not won the war yet. We've got ways to go. And this is the time for all of us to think about how do we reduce the loss of life and reduce the loss of suffering at this time for our society at this time. So individuals who are on the sideline still thinking about the vaccines or boosters, please do consult your doctors, talk to us, visit our website. And at the same time, you know, we've seen this surge hopefully declining right now and managed very well. I'm really proud of the entire healthcare system, not just Hartford Healthcare, but other systems in the state of Connecticut, how well we have managed and provided access and remained open for anything what needs to be done at this time. Connecticut has done a very good job, and I'm really proud of part of the system. As for society, most important thing is pay attention to the vaccines, boosters, masks. We can't give up at this time.
Well said. Thank you, Dr. Kumar, Dr. Wu, and of course, Sergeant Bransford for all that you're doing out there to help us. And thank you for watching. We will see all of you tomorrow.